I love talking to people that make me feel stupid because then I learn things. So I'm kind of curious, people come into your wellness center there. What's something that you do with a patient where it just absolutely blows their mind?
Well, probably the biggest wow factor is the stem wave. So stem wave is an electro-hydraulic true shockwave. There's a lot of shockwave machines on the market that are radial,
Uh-huh.
and the radial
Right. That's what
ones
I'm familiar with.
are more for the surface, like they treat the ligaments and tendons and things.
Yeah,
But
yeah. It's kind of just barely transcutaneous, right?
yeah, so but the true shockwave, like the stem wave, is electro-hydraulic, meaning it's driving the sound wave about that far. I mean, it's a good like 4 inches
Oh,
deep
wow.
into the body. So
Wow.
I'm able to
Okay.
target the deepest joints, like the SI joint, shoulder joint, hip joint, knee joint, actually into the joint. And so I have had, I can't even tell you, probably hundreds of cases where the person was in, chronic, pain with very limited range of motion for, in some cases, for years or decades. And after one treatment, they have their full range and no pain. It's not permanent,
Jeez. And how does that,
but that's the kind of
yeah.
result they get. And then I tell them right away, like, well, you're qualified as a candidate because that's what's required for you to actually get better. You have to have a result where you feel at least, I tell them 5 to 20%, but most patients are 50 to 80% out of pain
Yeah.
in
So
one session. It doesn't mean they're
how does that
healed
work?
though. And I tell them that. I was like,
Right.
you need to come back 10 times because every time we treat that joint, we're introducing more blood flow and stem cells, and it's cumulative. Every time you do it, it builds on the previous time, and in 10 sessions, the patient has a new joint essentially.
And how does that work? So I get the blood flow part. That makes sense. How does that work with stem cells? How does that help to
Well,
regenerate stem
okay,
cells?
so the mechanism, and they've elucidated this in many published studies. There's over 1,500 published studies on this type of shockwave therapy. Bottom line
Okay.
is you have these receptors in the cells. They're called toll-like receptors. When that sound wave passes through the cell, this toll-like receptor sends a signal to the body to recruit the dormant stem cells that are just laying around waiting for a signal. And so that toll-like
Okay.
receptor sends the signal, and then the troops come in and they do their job. They repair the joint.
That's pretty amazing. And so eventually, with enough of these sessions, it's like you're stacking repair, right? So the repair gets stacked on
I've
top of the
had
repair,
over
gets stacked on the
15
top of the
patients in the
repair.
last year cancel their shoulder surgery, knee replacement surgeries, disc replacement surgeries, hip surgeries, foot pain. I mean, you name it, any joint in the body, the stem wave essentially can fix it. I mean, I would say the success rate with a stem wave is about 95% of cases are going to
That is pretty
benefit.
darn high.
It's really high. And even if it's not 100%, the patient's going to be functional. Like I have the one guy, he
Yeah.
was he was getting ready to have a double knee replacement, and every procedure he did stem cells, he did PRP, he did all the latest cutting edge regenerative medicine. Nothing worked. And
Huh.
we started doing stem wave. It took longer than a normal patient because it was so bad, but he's doing deep knee
Okay.
bends now, and he does not need surgery.